Do you know that every year medical errors cost the healthcare industry over $20 billion in the cost? And worse, they account for nearly 250,000 deaths in the US alone. Long wait times, inefficiencies, and outdated processes are costing hospitals millions while putting patients at risk. But what if I told you that major hospitals reduce the patient wait time by 61% and decrease the medication errors by 73% and save more than $1 million annually, all using the same methodology? Today I am revealing how Lean Six Sigma is revolutionizing healthcare and why the facilities that don't adopt these principles will be left behind. Hello everyone, I am Nikhil, a certified Lean Six Sigma Master Black Belt, a digital transformation and operation excellence practitioner. For over 15 years, I have guided organizations through digital and operation excellence transformation. Here the challenge is unique. Unlike manufacturing, healthcare deals with human lives where variability isn't just an operational nuisance, it can be a life-threatening as well. That's why traditional Lean Six Sigma needs strategic adoptions for the healthcare environment. In this video, I will walk you through the exact framework I used with my healthcare clients, including some real case studies, common pitfalls, and a step-by-step implementation guide that your organization can start using immediately. And if you are in healthcare and not leveraging this, you are falling behind. But before I deep dive into this, if you are new to my channel, then do consider subscribing to this channel for more videos like this. So before we dive in, let's analyze why 78% of Lean Six Sigma implementation fail in the healthcare settings. First, healthcare has inherent variability that manufacturing doesn't. Patients aren't the widgets that each represents a unique conditions actually. They have complications and needs. Our data shows medical processes have 340% more natural variation as compared to manufacturing process. Second, stakeholder complexity is exponentially higher. You are balancing needs of patient, physician, nurses, administrator, insurance companies, and regulatory bodies with all different priorities. A typical hospital improvement project has 8 stakeholder groups versus 3 in manufacturing. And number 3, resistance to change is particularly strong in healthcare, where established clinical protocols and physician autonomy are deeply ingrained. Our study shows 64% of healthcare professionals initially resist process standardization compared to 29% in the manufacturing. So let me illustrate with an real example. So let's consider a Memorial Regional Hospital, and they implemented standard lean methodologies directly from the manufacturing. And 6 months and $450,000 later, they abandoned the initiative with zero measurable improvement. Why? Because they failed to adapt the methodology to healthcare's unique environment. Compared to another hospital, Northeast Medical Center, which customized their approach, and they achieved 42% reduction in their central line infections and 27 decrease in readmissions within the first year. The difference was adaptation, not adoption. Here is the healthcare optimized Lean Six Sigma framework I have developed through years of implementation. I am sharing concrete steps that you can implement starting tomorrow. Step number 1, patient-centered value mapping. Unlike manufacturing, where value is defined by the end customer, healthcare value must balance patient outcomes, provide efficiency, and system cost. So here's how. Start by selecting one high volume patient journey. Physically follow 5 to 10 patients through this journey with a simple tracking form. Put every touch point, wait time, and handoff. Then calculate the ratio of value add to the non-value added time. In most hospitals, this ratio is shockingly low, often below 20%. Number 2, clinical administrative integration. So here, traditional lean focuses on shop floor processes. In healthcare, you must integrate clinical protocols with administrative workflows. Here is how. Create a visual process map on a large wall using color-coded sticky notes. So you can say pink for clinical step, blue for administrative steps. Hold a 2-hour workshop roughly with representatives from all departments who touch the process. Identify where administrative and clinical stops conflict or create the bottleneck. These intersection points are your gold mine for improvement. Number 3, variability management versus elimination. Manufacturing aims to eliminate variability. In healthcare, you must distinguish between the necessary clinical variability and unnecessary process variability. Here is how. Use this simple task. Ask, would standardizing this step harm the patient care? If no, it's necessary variability. Create a 2-column document listing all the process steps with either standardize or manage variability next to each other. Aim to standardize at least 60% of your steps. Regulatory compliance standardization. Standardized process with constraints of healthcare regulations. Here is how. Create a simple checklist for each standardized process. Test it with your compliance officer by asking, does this meet all our regulatory requirements? Then test it with frontline staff by asking, is this actually easier than what you were doing now? So both answers must be yes. Then continuous measurement cycles. Implement 30-day measurement cycles focused on both process and the outcome metrics. Here is how to create a simple dashboard with no more than 5 metrics. Include both process metrics like wait times and outcome metrics like infection time, use a stop light color system: green for target met, yellow for within 15% of the target, and red for missing target. Review this dashboard daily in your 10 minutes huddle, and if you need help, you can download the implementation checklist from the link below, which includes the template for each of these steps customized to your specific healthcare improvement. So whether you are in a hospital, outpatient clinic, or specialized care facility. So let's take an example through a case study. So let me share a truly inspirational transformation of how one struggling emergency department went from near failure to becoming a national benchmark. So this is a story of Midwest Regional Hospital, which was facing a crisis. There was on an average 4.2-hour average wait time, and 18% of the patient left without being seen. So we call this as left without being seen rate, and declining patient satisfaction scores of 2.3/5. Staff burnout was at an all-time high with 37% turnover. The chief medical officer told me we were losing the battle every single day. So we implemented our healthcare adapted Lean Six Sigma approach. So what we did, first we conducted a patient-centric value mapping across 200 ED visits, identifying that 64% of the delays occurred at 3 specific transition points that were triage, imaging, and specialist consultation. The breakthrough moment came when veteran charge nurse said, "In 20 years, this is the first time I have seen our entire process on one page." So next, we formed an integrated improvement team with ED physicians, nurses, radiology staff, and administrative leaders. This cross-functional approach was crucial for breaking down the silos those were causing delays. One physician who was initially skeptical later became our biggest champion, sharing that, "For the first time, I understood how my decisions affected everyone downstream." Then we distinguished between unnecessary and the necessary variability. For example, we standardized the triage process while fixing the maintaining flexibility for different acuity levels. So this reduced the triage time by 47% without compromising the patient assessment quality. A nurse told me, "I used to fight standardization, but now I see it actually gives me more time for critical thinking where it matters most." For regulatory compliance, we redesigned documentation workflows to meet all the requirements while eliminating redundant steps. This freed up 76 minutes per nurse per shift. This is the time now they can spend at the bedside rather than on the paperwork. Finally, we implemented a 30-day measurement cycles, tracking both operational metrics and patient outcomes to ensure improvements were sustainable. The team celebrated each milestone, building momentum with every success. The results after 9 months transformed not just metrics but the entire culture. Average wait time reduced to 1.9 hours, so 55% improvement there. Left without being seen rate dropped to 4.7%, so that is 74% reduction. Patient satisfaction increased to 4.1/5. Annual cost saving of around 2 million from the reduced overtime and improved throughput. Staff turnover also decreased from 37% to 8% as workplace satisfaction soared. Most importantly, clinical outcomes improved with faster door-to-treatment times for critical conditions. ED director summed it up, "We came to work defeated and left exhausted. Now we have come energized and we leave fulfilled. We are saving more lives and going home happier." So before I deep dive into the most important point, the implementation roadmap, I have a request. If you are finding this video valuable so far, so make sure to hit the like button. It really helps us, more people like you, to discover this insight. And if you want more practical strategies on transforming healthcare operations with Lean Six Sigma, don't forget to subscribe and turn on notification so you would never miss an update. So now let's get back into the first 100 days implementation roadmap. So here, let's break down exactly how to implement this framework in your healthcare organization. So days 1 to 30, like for the first month, focus on foundation and analysis. Identify an executive sponsor, typically COO or your chief medical officer. Form a cross-functional team with clinical and administrative staff. Complete patient journey mapping for key service lines. Select baseline metrics for both process efficiency and patient outcomes. Provide basic Lean Six Sigma training adapted to healthcare examples. Days 31 to 60, pilot project selection and kickoff. Select a high-impact project, visible process for your pilot, which is ED, triage, OR turnover, discharge process. You can just choose any one of them. Then start applying your DMAC methodology. Define, measure, analyze, improve, control. Focus on quick wins to build momentum. Document both process improvements and challenges. So now day 61 to day 90. So expansion and standardization. So here focus on expand successful improvements related to the department, standardize the new processes with clear visual management, develop department specific metrics dashboard, train additional staff on the healthcare specific lean techniques. And now from day 91 to day 100, focus on sustainability and the governance. Establish daily management system with hurdles, create clear escalation paths for process abnormality, implement visual management boards showing real-time performance, develop continuous improvement council for ongoing governance. A crucial element often gets overlooked is the physician engagement. Unlike manufacturing, where managers lead improvement, healthcare requires physician champions. So identify and cultivate these champions early by focusing on how Lean Six Sigma improves patient care rather than just efficiency. Now let's discuss the common pitfalls and how to avoid them. After implementing Lean Six Sigma in dozens of healthcare organizations, I have observed the deeply human struggle and fears that derail even the most promising initiatives. Focusing solely on the cost reduction, not this, but we need to cut cost 15% from the department budget. So we don't want to do this. Instead of do this, we are improving patient flow to enhance both outcomes and efficiency using manufacturing terminology. So using manufacturing terminology, not this, let's optimize the value stream for patient visits. Instead of do this, we are enhancing the patient journey by removing the barriers to care. Number third, ignoring physician workflow. So instead of implementing the changes without physician's input, instead do this, co-designing solutions with physician champions. Number 4, measuring too many metrics. So not this, we should not be tracking 25 plus process metrics. Instead, we should be focusing on 3 to 5 key metrics linked to patient outcomes. Number 5, failing to celebrate early wins. So instead of waiting for the entire project to complete and then recognize the progress, instead of celebrating and communicating 30-day improvement cycle. Remember, in healthcare, the goal isn't perfection. It is consistent improvement that benefits patient while supporting the staff who care for them. Implementing Lean Six Sigma in healthcare isn't about operational efficiency. It is about creating the capacity to deliver better patient care. When done correctly, it alleviates the staff burnouts, improves patient outcomes, and creates a financial sustainability. So if you are considering this journey for your organizations, I have created a free healthcare lean assessment checklist that identifies your high impact opportunities. You will find the link in the description below. For those who find the value in this approach, please subscribe to this channel for more in-depth content on healthcare operation excellence. Next week, I will be sharing some exact metric dashboard templates that successful healthcare organizations use to drive their improvement efforts. What challenge are you facing in your healthcare improvement journey? Share in the comments below and I will personally respond with the targeted recommendation. Thank you for investing this time with me. Until next time, this is Nikhil Pal, helping you transform the healthcare operations for the patient who need it most.